If you have been prescribed methotrexate for rheumatoid arthritis, your first thought was probably about the side effects. But what if I told you that most of those horror stories are avoidable? In this 2026 update of methotrexate, I am sharing the latest medical insights on dosing, folic acid supplementation, and the simple lifestyle hacks that make this powerful drug less scary and more tolerable, and also protect your joints. Hi, all of you rheumatoid arthritis warrior. This is Dr. Ananta Subedi, your rheumatoid arthritis coach at the Room Doc, as well as a practicing rheumatologist here in Cary, North Carolina. Today, I'm talking about one of the most important drug in rheumatoid arthritis treatment, that is methotrexate. So I'll help you learn more about what are the new update on methotrexate for 2026. Before I go deeper, don't forget to like and subscribe to our channel so that this content reaches to much more other RA warriors who are in confusion about medication like methotrexate. Also, accept our gifts, the Holistic Rheumatoid Arthritis Guidebook, which is free for you, and also a smoothie recipe that you can create in the morning that will help fight against rheumatoid arthritis. Now, the first question that will naturally come to your mind is, what is methotrexate? Why we use this chemo drug to treat rheumatoid arthritis? Methotrexate is considered as the gold standard first-line treatment for rheumatoid arthritis. And there are some good reasons why this is a gold standard first-line drug. It is one of the most important disease-modifying anti-rheumatic drug and typically used in lower dose to moderate dose for treatment of patients who have moderate to severe rheumatoid arthritis. And the goal for using methotrexate is to prevent long-term joint damage. And it helps decrease inflammation, which is a primary driver in rheumatoid arthritis. Now, the next question is, how does it work? Methotrexate works by modulating your immune system function. It helps reduce inflammation by interfering with immune cells, which are actively dividing in your joint cells. That is a primary problem in rheumatoid arthritis, where there are too many immune cells in your joint and the joint lining become very, very thick, causing joint damage. It helps slow down the progression of rheumatoid arthritis and protect your joint from long-term joint damage. If you have RA, which is not well controlled, it can lead to long-term joint damage, which is irreversible. And methotrexate slows down that joint damage and even prevent that joint damage. Now, one key part that you need to understand is methotrexate is not a painkiller. It treats the underlying problem in rheumatoid arthritis, that is the inflammation. So methotrexate, along with a lot of your lifestyle changes, including your diet, exercise, sleep, and other things, help manage rheumatoid arthritis effectively. There are different ways of taking methotrexate, but one key component is methotrexate is a weekly medication, not daily. And this is critical to minimize the side effect. The dose of methotrexate varies depending on the severity and your other comorbidities, meaning other medical condition. Your doctor might start with around 10 to 15 milligram to start with, and it can be slowly increased up to 25 milligram. That is the usual typical dose. There are two different ways you can take methotrexate. One is you can take by pill, which is easier to do, but the absorption of the medication is quite variable. That means whatever you take by mouth, not everything goes to your joint. On the other side, if you take an injectable methotrexate, which is subcutaneous injection, it is better absorbed and often has a lower side effect. In particular, the gastrointestinal side effects are less with the injectable methotrexate. You can ask your rheumatologist which might be a better route for you, pill versus an injection, but you have both the options. Now, one of the other questions that might come up in your mind is, how do I decide? Is it oral versus injectable better, which is right for you? Now, in general, when you first start, methotrexate by pill might be a good option. In case your disease is not well controlled on the pill form, or if you are not able to tolerate the pill form due to side effects, then you can switch to injectable. And there are different forms of injectable methotrexate, including syringe version, or there can be auto injector, which are easier to inject by yourself. So talk with your rheumatologist which options might be better suited for you. All of you rheumatoid arthritis warrior, I hope you are liking the video. Please like and subscribe to our video so that you can get similar content easily accessible to you. And also share this content with other family members or other friends who have rheumatoid arthritis so that they don't have to be scared with methotrexate. Now, here are the key benefits of methotrexate. Methotrexate is a highly effective drug in controlling rheumatoid arthritis. It can help prevent the progression of the disease. It also helps protect your joint by preventing long-term joint damage that is irreversible. By controlling those inflammatory symptoms in your joint, it helps improve your quality of life and also reduce your long-term pain that is due to rheumatoid arthritis. And it is a very versatile tool. You can combine methotrexate with a lot of other medications. It could be other disease-modifying anti-rheumatic drugs, or you can also combine this with biologics. So you can use it in different ways. Now, this is the most important question I always get. That is the common side effects and how to manage. The number one being nausea and fatigue. But taking methotrexate in the evening or with your meal could help you minimize those side effects. The second side effect is mouth sores. Now, it's not as common, but it is very manageable. Adding folic acid supplement can help minimize these side effects. Some of you RA warrior might also experience hair thinning, which is usually mild and temporary. And folic acid supplementation is essential to minimize these side effects. With any medication, we need to closely monitor for side effects. So here is the monitoring guideline for methotrexate. Regular blood tests are important for monitoring your liver count and then the blood count, where it can sometimes decrease or increase those numbers. And always avoid alcohol while you are taking methotrexate, as methotrexate and alcohol both are metabolized by your liver. So it's important to avoid alcohol when you are using methotrexate. Methotrexate is contraindicated during pregnancy. Hence, it is very important to use effective contraceptives when you are taking methotrexate. And typically, methotrexate does not work fast. It's not a very fast drug. So have patience. It typically takes 6 to 12 weeks to show its full benefit. Even by that time, many of my RA warriors, they may not feel better. Hence, we need to combine methotrexate with other medication. That's how it can become more effective. Now, here are the key points that will help you live a fulfilling life despite having rheumatoid arthritis and taking methotrexate. And the number one is consistency is the key. Take your dose exactly as prescribed and once a week. And if you have any side effects, communicate fast and effectively with your primary care doctor as well as your rheumatologist so that they can monitor closely and work with you to minimize the side effects. And as I discussed earlier, patience is key. It may not work immediately, but long-term, it has a lot of benefit that will help you manage rheumatoid arthritis effectively. But in general, methotrexate is a powerful drug that will help you manage rheumatoid arthritis to keep you active and a fulfilling life despite your RA diagnosis. Thank you all of you RA warriors for watching this video. If you like this video, please give us a thumbs up and subscribe to our channel if you have not already done it. And also share this video with other people who might have rheumatoid arthritis so that they can understand better more about rheumatoid arthritis and methotrexate. And I'll see you in the next video. Bye-bye.